The Model Systems Knowledge Translation Center presents Fatigue After Traumatic Brain Injury. This slideshow is based on research conducted by the Traumatic Brain Injury Model Systems and serves as a resource for individuals with traumatic brain injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This presentation summarizes research on the effects of fatigue on people with TBI. The information can help people with TBI and their caregivers recognize the symptoms and treatment options for fatigue. Fatigue is a feeling of exhaustion, tiredness, weariness, or lack of energy. After TBI, you may have more than one kind of fatigue. Physical fatigue. I'm tired and I need to rest. I'm dragging today. Psychological fatigue. I just can't get motivated to do anything. Being depressed wears me out. I just don't feel like doing anything. Mental fatigue. After a while, I just can't concentrate anymore. It's hard to stay focused. My mind goes blank. Some of the types of fatigue are physical fatigue. Can come from muscle weakness. The body needs to work harder to do things that were easy before the TBI. Physical fatigue gets worse in the evening and is better after a good night's sleep. Often, this kind of fatigue will lessen as the individual gets stronger, more active, and back to his or her old life. Psychological fatigue is associated with depression, anxiety, and other psychological conditions. This type of fatigue gets worse with stress. Sleep may not help at all, and the fatigue is often at its worst when you wake up in the morning. Mental fatigue comes from the extra effort it takes to think after your brain is injured. Many common tasks take much more concentration than they did before. Working harder to think and stay focused can make you mentally tired. When you are fatigued, you are less able to think clearly or do physical activities. If you are overwhelmed by fatigue, you have less energy to care for yourself or do things you enjoy. Fatigue can have a negative effect on your mood, physical functioning, attention, concentration, memory, and communication. It can interfere with your ability to work or enjoy leisure activities. It can make activities such as driving dangerous. How common is fatigue after TBI? Fatigue is one of the most common problems people have after a traumatic brain injury. As many as 70% of survivors of TBI complain of mental fatigue. Some of the conditions that are known to cause or increase fatigue include depression, sleep problems such as sleep apnea, seasonal allergies, hypothyroidism or other endocrine gland disorders, respiratory or cardiac problems, headaches, lack of physical exercise, vitamin deficiency or poor nutrition, stress, low red blood cell counts or anemia, medications commonly used after TBI such as muscle relaxers and pain medication. Some of the things you can do to address fatigue are: pay attention to what triggers your fatigue and learn to identify the early signs of fatigue, such as becoming more irritable or distracted. Stop an activity before getting tired. Get more sleep and rest. If you have insomnia, tell your doctor. There may be a medical condition causing this, or there may be useful treatments. Set a regular schedule of going to bed and awakening the same time every day. Your body and mind will be more efficient. Include some regular rest breaks or naps. Be careful to limit naps to 30 minutes and avoid evening naps. Alcohol and marijuana will generally make fatigue worse. Caffeine, such as coffee and cola products, should be avoided after lunch if sleeping is a problem. Resume activities gradually, over weeks or even months. Start with familiar tasks in home or work that you can complete without fatigue. Gradually increase the complexity of each task, taking breaks as needed. Improve your time management by planning and following a daily schedule. Using a calendar or planner can help manage mental fatigue. Prioritizing activities. Finish what is most important first. Doing things that require the most physical or mental effort earlier in the day when you are fresher. Avoid overscheduling. And limiting time with visitors. Exercise daily. Research has shown that people with TBI who exercise have better mental function and alertness. Over time, exercise and being more active helps lessen physical and mental fatigue and builds stamina. It also may decrease depression and improve sleep. When talking to your doctor, discuss medical or physical problems that may be causing fatigue. Have your doctor review all your current medications. Tell your doctor if you think you might be depressed, so treatment can be started. Ask your doctor if there are any blood tests that could help to find out what is causing your fatigue. For additional resources on living with a traumatic brain injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.